Welcome back to Care Decoded, the show where we simplify the complex world of risk adjustment, documentation, and AI to power better care. My name is Lucy Medina, and I'll be your host today. Today's episode is especially close to home. We're diving into something every clinician has felt but rarely talks about: documentation burnout. From endless clicks to broken workflows, we'll unpack how the current system often takes more than it gives and how we can shift from burden to benefit. And for this episode, we're switching things up a little bit. I'll be interviewing you today, Sunil. And as many of you already know, Sunil is the CEO at Inferscience, but he's also a practicing physician. So he sees the real impact of documentation challenges and breakthroughs every single day. So welcome, Sunil. And if you're ready, we'll start with the first question that I have for you today.
Thank you. Thank you for being the host today.
Yeah, of course, of course. All right, so let's dive in. Let's start with something really honest. Do you remember a time when documentation completely derailed your clinical workflow, maybe even cost you a moment with a patient?
Yeah, I mean, I'll start with an obvious extreme example. If you lose power or you lose internet, right?
Yeah.
So, I mean, that completely derails it. I mean, there have been obviously occasions for me, and I'm sure for other clinicians, that sometimes you have to send the patient home because we are so reliant on the EHRs. Obviously didn't used to be that way with the paper charts. Doesn't mean that I'm advocating we go back to paper charts, but just, there's a very heavy dependency on technology, right? But even if you think about other things, like I know there are certain colleagues in my area who use headsets to basically dictate the note as they are talking to patients. And as you can imagine, that is pretty disruptive. And I've never heard a good thing from a patient about that. So that's where, it's really intruding right in your face. But the majority of the time, it's not as bad. Majority of the time, what is happening is that the physician is so focused on the documentation that they are not even really talking to the patient. They are looking at the screen while the patient is talking, and it's not the greatest of experiences, right? I tend to type pretty good without without actually having to look at the keyboard, so I can actually type while I'm talking to patients. I haven't heard too many complaints, but yeah, generally speaking, it's the technology is too intrusive, I think, during the patient encounter.
Right, right. Yeah, I would agree. I mean, you lose a little bit of the like in-person contact, face to face, like more personal contact if you're having to look at your computer or even speaking just dictating and everything. Yeah, I
Exactly.
mean, that definitely makes sense. So, before we really get tactical, how would you describe the emotional tax that today's documentation systems put on physicians?
Yeah, I mean, documentation, there are obviously studies that show that physicians spend more time documenting than actually talking to the patient, seeing the patient, right? So that's a huge burden. And not even only during the patient encounter, because there's so much to do as far as documentation is concerned that you really cannot finish the documentation while you're with the patient, right?
Yeah.
Because you've got other people waiting. It's a line, it's every 15 minutes or whatever, right? The cadence is. So at the end of the day, you are stuck with, I don't know, whatever number of patients you saw, 15, 20, 25 charts that you have to complete. And depending on how diligent the provider is, it's an easily a minimum hour, maybe 2 to 3 hours a day they're spending, right? After they're done with patients. So what that also means is that a lot of times they're bringing it home and they're doing it after dinner or on the weekends. I mean, I have a buddy of mine who's a gynecologist, and for years did not want to play tennis with us on the weekend because he had to do his charts. So I think eventually, after a few years, he did catch up to a certain extent. But yeah, it's just it affects family life. It affects your interaction with your kids. So yeah, it's there's a big burden on the physicians.
Yeah, definitely. Not a lot of work life balance and time to recharge, really, right?
Absolutely.
Definitely. And why do you think most EHRs have failed to support good documentation workflows? Do you think it's like a tech issue or more of a design philosophy issue?
Yeah, I think the root of this is that most EHRs started as an add-on to a practice management system. And really, these were built by engineers. And I don't know how much usability went into the design philosophy.
Right.
But if you look at the way things are, I mean, you have to click multiple times when you could easily, if you had designed a proper flow, then you wouldn't have to do so many clicks and things like that, right? So, and yet there are a lot of EHRs like that are thriving in the marketplace today because, there are big health systems and practices which are kind of bought into it and they have too much invested because switching to another EHR is just it's a very tall order, right? I mean, not
Yeah.
just financially, but just operationally, it's a massive task. So they are getting away with it, and in the meantime, the providers are bearing the brunt of it.
Yeah, yeah, we hear about that a lot where some practices are stuck with an EHR that maybe is not helping make their documentation or workflows more effective, but changing to another EHR would be so much more work, right? So
Exactly.
definitely, yeah, definitely an issue. So let's talk impact with that. When documentation tools don't work, what really do you think gets compromised? Clinically, financially, and emotionally.
Yeah, I mean, emotionally, we talked about that impact, right?
Right.
But even clinically, because the EHRs are, for want of a better word, pretty clunky in general. And some people are more, how should I say, proficient with it. Providers I'm talking about, others are not. This is not a knock on them clinically. It's just, some not everybody is that tech savvy, right? So if a provider can't do a good job of documenting and other clinicians are relying on it. So for example, there's you send a patient to a consultant, right? And if they have not done a proper job of documenting and they're coming back to the primary care physician and they don't know what they did, so now they're in the dark. The patient already, because, oh, the doctor only spent 2 minutes with me or whatever the case is, right? They have no clue about what happened, right? And now I am supposed to help them with that, but I cannot because I don't have proper documentation, right? So then a lot of times, yeah, obviously there's anxiety on part of the patient, that there's that emotional burden, but also you end up ordering tests or things get delayed, or yeah, I mean, at the end of the day, the clinical care does get affected because that documentation is not there, that communication is not there. But even financially, the documentation is supposed to support what you bill for, right? Now, if you have not done a proper job of that and there's an audit, there's a possibility that, some payer is going to try to claw back the money. And when you're dealing with the government, it could have more than just clawing back money, right? There could be some penalties. If the medical board gets involved, now you're in trouble with the board. So there's a lot of stuff that can happen when the documentation tools don't work like they're supposed to.
Yeah, definitely a lot of consequences. Double work, costs financially. Yeah, not great.
And not just suboptimal care, I guess would be the word, right?
Yeah.
Yeah.
Yeah, patient care. Yeah. So we know when it comes to coding, many systems still rely on retrospective coding or third party reviews. We were talking about how documentation and when tools don't work, this affect financially as well. So, when it comes to coding, what do you think is the hidden cost of delayed documentation in value based care?
Yeah. So I think the most obvious is that, say a patient saw a cardiologist, right? The patient is fairly sick and for whatever reason, and I mean, I know people who have these challenges, right? So they don't do a proper job of documenting, right? The patient has five, six conditions, but now because they have not done a proper job of the conditions and the supporting data, the patient looks a lot, how should I say, healthier than they actually are.
Okay.
So at the end of the day, that those codes are not captured, even on the retrospective review, because the coder really cannot divine what the clinician was thinking or what happened, right? So at the end of the day, you end up, for want of a better word, leaving money on the table because you did not do a proper job of capturing those, right? The flip side of it is that now coder captures something based on some sort of inadequate data, right? Now
Yeah.
you are at risk that once you submit it and it goes to an audit, you don't have enough to support it, right? So either way, you can get screwed, so to speak. So I think yeah. So there's a lot of impact. Bottom line.
Yeah, yeah, that definitely is not great. So let's flip this script a little bit. What do you think documentation should look like in 2025 and beyond?
Yeah, I think there are definitely, what should I say, shoots of hope in this arena. And I think, Lucy, you are aware of Ambient Scribe. I'm sure a lot of our listeners will be aware of Ambient Scribes, where there's an application or that is listening in as the encounter is happening. And basically using AI, the whole encounter gets documented. I have recently started using it in my practice, and yeah, I find it quite useful that it documents the whole thing, and later on I can go edit it however I want. But at the end of the day, it does a decent job of capturing the what happened during the encounter, right? So I think that is a very nice feature, which hopefully over time will help people save time, do better documentation, and still get home on time. And there are plenty of studies I've seen from AI scribe companies, which is what they're showing, that it's drastically reducing the time required for documentation. But also, I mean, I think over time we will see other what should I say, other use cases as well, right? So, in terms of analyzing data out of the EHR and showing it to the providers in a nice user friendly manner, or even you putting clinical decision support on top of that, so that now you have help where it can give you hints that, okay, based on guidelines, this is how the care should be, right? So it doesn't mean that the provider, that AI is taking over, but it's a tool or a supplement. So I think that's just one other use case of where AI can be truly helpful.
Yeah, it sounds like AI is contributing for a more promising future with documentation, right?
Absolutely, absolutely. And I think this is just the beginning of where it's going.
Yeah, yeah, definitely. I would agree with that. And I've heard you mention before that, well, speaking of AI, that AI should disappear into the workflow. What do you mean by that?
Yeah, basically what that means is that it is intuitive enough that it's doing certain things without you triggering those processes, right? So if it's
Right.
giving me some sort of insight that this patient is at high risk for a certain condition, or based on the documentation and the lab data, etc., that this patient should be on such and such medication. So if you can get that in your workflow while you are seeing the patient, I think that type of stuff really, where it's not, I mean, it's not intrusive. I mean, giving you a suggestion. It's not forcing you to do anything, right? So that type of stuff, presuming it's done right, right? There's a difference between the signal and the noise, right? So the signal should far outweigh the noise, and that's where it will be helpful. On the other hand, if it's a bunch of nonsense where there are some very loose criteria for suggesting something, then it actually ends up not helping you. But hopefully, these will be designed in such a fashion where there's a lot more noise, signal than noise.
Yeah, that makes sense. Shouldn't be disruptive or intrusive or adding
Yeah,
more work. It should
exactly.
really just be something that will merge into the workflow. And so for health plans or systems evaluating documentation technology today, what's one non-negotiable you think they should demand for any solution, whether it's AI or just
Yeah,
technology tools?
I think it depends, right? So if you're talking about like an AI scribe, I think uh, usability where it works in the background and does a good job of putting everything where it should, right? Now, it may not always capture the intent, or there are nuances in these sort of these discussions we are having with the patients are very interactive, extemporaneous, as they say it, right? So it may not always capture the spirit, right? But as long as it's doing a decent job putting things in the right place, you can, I mean, as a clinician, we should be going in and editing it and looking at it and editing it anyway, right? So that's fine. So that type of usability thing is important. But when you start talking about things like, for example, clinical decision support, I think in that case, the reliability and accuracy would be the most important, right? So, but by far, I think design and usability, generally speaking, would be number one.
Yeah, definitely. And accuracy is a big one.
Exactly.
I
Yeah.
definitely agree with that one too. Yeah. And well, speaking of technology tools, of course, you work to build technology tools at Inferscience that can be great to improve documentation workflows. So, can you tell us a little bit about a reaction you received from a clinician using Inferscience that has stuck with you? And yeah, that reminded you why you started this.
Yeah, absolutely. So, as you know, I have a sort of a dual life, right? Running in for science, but also seeing patients half of my time. So one day, this was a couple of years ago, I was interviewing a candidate for a nurse practitioner in my office, and as it turned out, at the time, she was working at one of our customers about. I don't know, their office was like 40, 50%, 50 miles from where my office
Yeah.
was.
Mhm.
So she did not know that I had any involvement in InfoScience. So when she came and I knew where she was working, I said, I know that you guys are using some sort of a tool for risk adjustment. And she immediately broke into this big grin. She said, "This is fantastic. It's really helped my life. And I can't tell you how grateful I am to the people who've built it." So, and this was just, like I said, she did not know that I had any involvement. That really struck by me that, okay, at least one person is really happy with what we are doing. It's improving their life. So,
Definitely great to hear that feedback.
yeah.
Yeah. And so let's close this with a final thought. You often talk about going from burden to benefits. So, what's your message to clinicians who've kind of lost hope that things can get better?
Yeah, I think things are definitely getting better. I mean, progress is slow a lot of times, but as you probably know, there's been a big push from the government side on interoperability,
Yeah.
right? So data is flowing a lot better. I mean, there used to be, when we started, tremendous amount of, what should I say, obstructions or roadblocks in terms of obtaining data from EHRs and stuff. I think a lot of that has largely disappeared. But from the clinician perspective, what that means is that there are a lot of the whole ecosystem has a lot of applications and things like that. And obviously, there's new technology like AI. But what that means is that there are a lot more players who I think have their priorities right, that they want to help clinicians. And therefore, as opposed to having certain incumbents like these big, fat, happy EHR companies who couldn't care less, and because they were getting the revenue and they had the customers. So I think we are moving to a much more open marketplace, and with this free flow of data and now obviously the influx of technology, I think there's a lot more, and at least in the newer EHRs and applications that I've seen, there's a lot more focus on the usability and preventing burnout and things like that. So I think there's definitely a better future ahead from documentation, and not just documentation, but even clinical decision support help for clinicians.
Yeah, we can definitely be hopeful with all the improvements that we're seeing.
Absolutely.
Definitely. Well, thank you so much. That's actually a wrap on today's episode of Care Decoded. Thank you, Sunil, for answering all these questions and bringing both insight and also empathy to this conversation. And to our audience, if this resonated with you, follow the show, share it with a colleague, and let's keep decoding care together. Thank you, everyone.